People on Google are asking what's the difference between dementia and Alzheimer's. Dementia is an umbrella term for a set of symptoms that affect memory, thinking, and social abilities severely enough to interfere with daily functions. Alzheimer's disease is the most common cause of dementia, accounting for 60 to 80% of dementia cases. Dementia can be caused by various conditions, including Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, and others. The symptoms vary widely, but generally include memory loss, difficulty with communication and language, inability to focus and pay attention, impaired reasoning and judgment, and visual perception issues. Alzheimer's is a specific brain disease marked by the accumulation of amyloid plaques and tau tangles, which leads to the progressive loss of brain cells. Initially, symptoms involve difficulty remembering recent events or conversations. As the disease progresses, symptoms start to include severe memory impairment, disorientation, mood and behavior changes, deepening confusion about events, time and place, and more severe cognitive decline. It's named after Dr. Alois Alzheimer, a German psychiatrist and neurologist. In 1906, he observed and described the case of a 51-year-old woman who had unusual symptoms, including memory loss, language problems, and unpredictable behavior. After her death, Dr. Alzheimer examined her brain and found abnormal clumps, the amyloid plaques, and tangled bundles of fibers. His detailed findings were published in 1907, and his work laid the foundation for understanding the disease. Over time, as more cases were identified and studied, the condition became known as Alzheimer's disease in recognition of his work. And while there is no cure for these conditions, today researchers are exploring the various causes of different types of dementia, including genetic, environmental, and lifestyle factors. Studies focus on how vascular health, brain injuries, and neuroinflammation contribute to the disease. Trials like the FINGER study have shown that multi-domain lifestyle interventions can improve cognitive function in at-risk populations. Genetic and pharmacological research is also constantly making strides, driven by the urgent need to find effective treatments and ultimately a cure. Some famous people with Alzheimer's disease: Ronald Reagan, the 40th President of the United States. He announced his Alzheimer's diagnosis in 1994, 5 years after leaving office. Charlton Heston, the Academy Award-winning actor known for his roles in films like Ben-Hur and The Planet of the Apes, announced in 2002 that he had symptoms consistent with Alzheimer's disease.
I had a PET scan and it gave me time, precious time.
And some famous people with other forms of dementia. Robin Williams, the beloved actor and comedian, was diagnosed after his death with Lewy body dementia in 2014. His widow, Susan Schneider Williams, has since become an advocate for awareness of this lesser-known form of dementia. Rosa Parks, the civil rights icon, was diagnosed with progressive dementia a year before her death in 2005. But her struggle with the disease was not widely known until after her death. So, to sum up, dementia is an umbrella term for a range of cognitive impairments caused by various conditions, whereas Alzheimer's disease is a specific brain disorder and the most common cause of dementia. There it is, the difference made clear, I hope.